Good evening. 2 days after being blasted by the Health Minister, the carer who triggered Sydney's latest coronavirus outbreak in a nursing home is said to be mortified. The Police Commissioner has now jumped to her defence. Families of residents say those now in lockdown are living in fear.
New March, the new focus of Sydney's corona crisis. The lockdown aged care home visited by police to ensure there was no criminal liability.
Obviously the key question is around, was there reckless intent? And my understanding there wasn't.
But on Monday, a suggestion there was.
There was a healthcare worker who went to work for 6 days, 6 straight days, when she was already feeling sick.
4 residents and 6 staff testing positive, infected by the carer who says she had no symptoms and no idea.
This person is absolutely mortified.
And the families so anxious.
It's heart-wrenching.
Nicole Fay's grandmother is a 2-year resident. She knows the aged are most at risk.
Like as a family, we do know that the ratio is not too great because they are so at risk.
Staff doing everything they can.
Most of them are safe, like everywhere, sanitizing.
Well, I think the initial shock from hearing that you have a positive case of COVID-19, obviously that's traumatic for everybody.
Health authorities say their approach here has been shaped by what they learned from the lethal outbreak at the Dorothy Henderson Lodge in Macquarie Park. There, 6 died, and they're admitting that they're not underestimating the challenge of containment.
Overall stats, though, are still positive. Just 16 more cases overnight. The new total, 2,886. New data too from Apple. Reduced map searches graphically showing the lockdown effects. 42% down for drivers, 58% for walkers and 77% on public transport. Not that everyone is abiding by the lockdown laws, numbers increasing on the northern beaches. Good news today, though, for tradies. A $50 million relief package waiving all licence fees.
When you're doing it tough, when you're making ends meet, one less bill to worry about is relief.
200,000 businesses set to benefit.
And Chris Reason joins me now. Chris, virus testing is now open to anyone with symptoms anywhere in the state.
Yeah, good evening to you, Mark. This is a major change in policy for the state government, and one it spent months resisting. But now, at this morning's press conference, the Premier, Gladys Berejiklian, says that she will encourage anyone and everyone with symptoms to step forward to a testing centre anywhere in the state. And they want to take the numbers of tests up from the lows of 1,300 we've seen in recent days back up to the highs of 4,500 that we saw last week, doing everything they can to try and eradicate this virus. Mark?
OK, Chris Reason, thank you. The Ruby Princess disaster has claimed the life of yet another passenger, with the death toll now 19. Mounting pressure has forced the Premier to announce a special commission of inquiry with unlimited powers, just as the cruise ship is prepared for departure.
The Ruby Princess waits to set sail. Sunday floated as the day of departure.
This will be over. I hope to be very soon.
The ship claiming a 19th life, a woman in her 60s from Canberra.
This is an absolutely heartbreaking situation.
The number of infected crew on board up 13 overnight.
If it was spreading now and nobody told us, that would be horrific.
Operator Princess Cruises accused of rejecting flights home for healthy staff.
And that still stands, but at the end of the day we are certainly getting mixed messages.
Labor wants the government to test everyone on board before the ship can leave.
If one person dies on that vessel, then that is on your conscience.
A grim warning: medical evacuations at sea may not be possible.
Lives at risk, they start stacking up the bodies in the freezers.
Princess Cruises says it is still working with various government agencies to get final health clearances for the crew and identify those willing to stay on board to get the ship back to home port in the United States.
The Ruby can't stay forever.
But her presence will linger, the Premier finally committing to a commission of inquiry.
I didn't want to be in a position where it looked like government had obfuscated.
George Pell's lawyer, Brett Walker, to report within 4 months. No guarantee his hearings will be public.
He will have all the powers he needs to do what he needs.
The ship's coronavirus survivors want nothing less. Passenger Kiralee Ryder spent 18 days in an induced coma.
I went to sleep in one reality and I've woken up in another.
Alex Hart, 7 News.
World economists have called it the Great Lockdown, warning Australia faces a deep recession with our economy shrinking by more than 6%. A strong recovery is predicted once the pandemic is over, but not before the turmoil inflicts financial pain on millions of Australians.
The biggest economic meltdown since the Great Depression now has its own name.
The world has been put in a great lockdown.
The Great Lockdown that is putting economies like Australia's into induced comas and, according to the International Monetary Fund, heading into the first recession in almost 30 years.
This is a crisis like no other.
The IMF predicting Australia's economy will contract by 6.7%, putting it among the hardest hit in the Asia Pacific.
A bigger hit than the US, the UK, Canada, Japan, Korea.
But if the crisis passes by year's end, we'll grow by 6.1%, providing the V-shaped recovery the government's hoping for. Treasurer Josh Frydenberg pointing out that the IMF calculations were done when Australia's infection curve was increasing by 20% a day.
Since that time, we've bent that curve.
That daily growth rate now just 2%. Also,
it was before the JobKeeper payment was announced.
Both factors likely to cushion the economic blow. And while New Zealand Prime Minister Jacinda Ardern and her ministers announced today that they'll join many workers accepting a 20% pay cut, it seems our politicians aren't prepared to follow in that regard, let alone lead. They have frozen their 2% pay rise for now, but
that's the action that we've taken.
No pay cut. Mark Riley, 7 News.
Teachers say the Prime Minister's call for them to return to the classroom has raised anxiety and sent a confusing message. While the Premier isn't rushing to make changes, she has indicated our education system could begin returning to normal within weeks.
Eleanor Clapham is a children's entertainer. When schools effectively closed, so did her livelihood.
I got the call from my agent saying all of your shows have been cancelled.
The upside, it gives her time to homeschool Lily and Lucas.
We want to just reduce numbers in the classroom for the parents that don't have the luxury that we do.
Many single or low-income parents have no choice but to work. It is for them the Prime Minister issued a call to arms for teachers to return to school.
It is even more essential for those vulnerable students who we know won't get an education at home.
When Term 2 begins, April 27.
At least the first couple of weeks will be similar to what parents experience at the end of Term 1. But beyond that point, I would like to see a change.
Schools resumed in Victoria today with many deserted classrooms and health checks. Teachers here say the Prime Minister's message is confusing.
It's not safe for children to go to a public playground, yet it's okay for them to be in a school. We're told it's not safe for children to be looked after their grandparents, but it's okay to be taught by teachers who are grandparents.
The government says it will not make a firm decision on when school can resume full time until the data is more conclusive on just how coronavirus spreads within the school community. But early evidence from the National Centre for Immunisation Research is encouraging.
The adults are actually the ones that are spreading amongst themselves, as opposed to children being a key driver.
Robert Ovadia, 7 News.
2 spitting attacks on frontline health workers were allegedly so vile, police charged the people involved with assault instead of just fining them. Andrew Denny is at Hornsby Hospital tonight. Andrew, a doctor there was treating an injured woman when police say she turned on him.
That's right, Mark. It happened here on Monday night when 35-year-old Monique Saffer was being treated for cuts to her arm after punching a window. Now, she was allegedly intoxicated when she spat in the face of her treating doctor and flicked blood on him. She was detained and later charged with common assault, a tougher penalty, police say, than the supposedly mandatory $5,000 fines that were announced last week for offences of this type.
That woman will be criminally charged, which is obviously can be much more serious in terms of jail time. But everyone spitting will get a $5,000 ticket and/or will be criminally charged.
Now, the second incident happened up at Foster, where 2 paramedics were repeatedly spat on by a man they were trying to help. In both cases, alcohol was involved, but police say there will be a zero-tolerance approach to any attacks on our frontline medical workers. Mark.
Andrew Denny at Hornsby, thank you. A Victorian man who left coronavirus quarantine to go on dates has become the first Australian jailed under new emergency laws. Jonathan David snuck out of a Perth hotel through a fire exit to catch the train to see his girlfriend several times. The 35-year-old will now spend at least a month behind bars. He was also fined $2,000. Tracking where people go using their phones to pinpoint how the virus is spreading will only work if enough Australians agree to download a new app. As we reported last night, the government's appealing for everyone to sign up, but there are privacy fears.
An end to isolation could depend on enough of us downloading a smartphone app.
If you've come into contact with someone who has the coronavirus, it's in your interest to know that. And it's in the interest of people around you to know that.
Work is underway across the globe, including a rare partnership between tech giants Google and Apple to develop an app that uses a phone's Bluetooth to trace contact with nearby people and their phones. So if they test positive, you can be notified.
So if you come in a few metres of another smartphone, it'll go into a database.
The catch, a majority must have the app for it to work. And in Singapore, a trial there has seen just 12% of the population sign up. There are, though, privacy concerns. It's not unusual for apps on your phone like Facebook or Amazon to track your location. The difference here, it'll be the government that knows where you've been.
I think that we have to be very confident that the government isn't tracking us without good reason.
The app is voluntary, it's an opt-in, and the privacy issues are being worked through by the Attorney General.
The selling point, the more who use it, the sooner we can all get back to normal. Cameron Price, 7 News.
Donald Trump has made good on his threat to rip US funding from the World Health Organization. The president claims the global body engaged in a cover-up, failing to tell the world the truth about what was happening in China.
With his sights set on recovery, Donald Trump met those who've recovered.
They're very brave. Some were right at the edge. They thought it was over.
Hosting COVID-19 survivors at the White House.
How are you now?
I'm great.
Would you say 100%?
I would say 85.
Stay away from me, please. Stay away. Keep her away.
As he further distanced himself from the World Health Organization.
Today I'm instructing my administration to halt funding of the World Health Organization.
Accusing the global body of mismanaging the coronavirus crisis by pushing Chinese misinformation, leading to a 20-fold increase in cases worldwide.
Those tasked with protecting us by being truthful and transparent failed to do so.
The coronavirus toll continues to soar in the United States. The country has now seen more than 26,000 lives lost, with a big spike today here in New York City. Authorities revising the death toll up more than 3,700 as they now include people who died before they could be tested.
In California, 7 crew on board the Navy hospital ship Mercy have tested positive. But as America's curve continues to flatten, the president faced a backlash over his declaration he will decide when each state reopens.
When somebody's the president of the United States, the authority is total.
Do we want a king or do we want a president? And we opted for a president. So that statement cannot stand. Period.
Donald Trump now says the decision will be left to governors and that some will make it before the end of the month. In New York, Paul Carrack, 7 News.
Keeping elderly residents safe from COVID-19 is coming at a hefty price for aged care operators who warn the financial stress could cause their sector to collapse. They're calling for a $1 billion-plus rescue package as they try to protect those most at risk.
Aged care groups warn there's a cost to keeping COVID-19 out of the very places it is most lethal.
In many countries, deaths in aged care account for more than 40% of their national death total.
$15 a day for each Australian in residential care, $10 a day to support those in home care, $250 million.
While we need to keep people healthy and well, we also need to keep them socially connected.
So their demand includes devices and other IT to keep residents in touch with families, another $500 million.
We need $1.3 billion. That's what we need to look after 1.3 million people across Australia.
Kieron Foley runs a Northern Sydney aged care complex. It, like much of the sector, is in lockdown.
If we do not get the required money, there's going to be, unfortunately, casualties.
The Minister says aged care is not forgotten, and 2 funding announcements in March will reinforce staff and services. The sector says that federal funding is largely to deal with coronavirus outbreaks after they happen, not strengthen aged care and prevent them. As well, they warn many of their businesses were already going broke before the pandemic added a layer of costs. Tim Lester, 7 News.
An Australian-first virtual hospital has been set up in the state's north, allowing doctors in Armidale to monitor coronavirus patients in their homes. Their vital signs are being sent in real time, freeing up hospital resources to help those who need them most.
Even hospital treatment can happen from the comfort of home, with high-tech monitors now being trialled.
Well, if it saves me having to be in hospital, I think it's a very good idea.
160 of these wireless monitors are being rolled out to COVID patients around Armidale and Tamworth, checking their vitals in real time, including heart and lung function.
It's almost like the level of monitoring that you would have in an intensive care or an emergency department.
The data from these monitors will be transferred down the line, transmitted to a virtual ward that we have in the hospital here.
Real-time data displayed on screens at Armidale Hospital, watched closely by clinicians around the clock. If a patient's condition worsens, they're brought in for emergency care, helping doctors prioritise.
To free up some more hospital beds as they become more and more precious.
And helping healthcare workers minimise unnecessary contact.
The new technology coming out, which allows us to care for patients in their homes, is a real groundbreaker.
Similar remote hospitals are being run in the US and places like Israel. Technology even being used to combat the spread of COVID-19 here in Western Sydney.
Symptoms reported by coronavirus patients via an app tracked by doctors. Serena Andaloro, 7 News.